All right, today we're going to talk about a little pill that millions of people around the world are familiar with, omeprazole. We're going to follow its incredible journey inside the body to see exactly how it works its magic and brings so much relief. It all kicks off with a problem that I'm sure many of you have felt, that fiery, burning sensation of heartburn or acid reflux. It's just awful. It's disruptive, and it's a huge sign that the incredibly strong acid in your stomach is, well, not staying where it's supposed to. And that's where our hero, omeprazole, enters the scene. Now, this isn't just any old antacid. It's part of a special class of drugs called Proton Pump Inhibitors, or PPIs for short. And here's the game changer. Older antacids just temporarily neutralize the acid that's already there. Omeprazole's different. It goes straight to the source and tells the acid factory to just shut down production. So, to really appreciate what omeprazole does, we first have to understand the villain of our story. Why exactly is stomach acid such a big deal that we need such a powerful drug to keep it in check? Well, gastric acid is a classic double-edged sword. You absolutely need it to break down food and zap any nasty bacteria. But when you make too much of it, or when it starts creeping up into your esophagus, that same corrosive power can do some serious damage, causing pain, ulcers, and even worse conditions down the line. And that brings us to the main event. This is the really cool part. How in the world does one little pill go on this incredible mission through your body to shut down those overactive acid factories? It is a truly fascinating journey. Think of it like a 5-step secret mission. First, it has to survive the acid bath of the stomach itself, and it does that with a special protective shield called an enteric coating. Then, once it's safely in the small intestine, it gets absorbed into your bloodstream. From there, it hones in on its target, these specific cells in the stomach lining called parietal cells. Now, here's the genius part. The drug only becomes active once it's inside the superacidic environment of those cells. And finally, once activated, it finds the proton pumps. Think of them as tiny acid faucets, and permanently turns them off. And this diagram shows that final knockout blow perfectly. You can see the omeprazole molecule zeroing in on what scientists call the H plus K plus ATPase. But for us, we can just call it the proton pump. By locking onto it, it physically stops acid from being made. It literally turns off the tap. Now pay close attention to this because the key word here is irreversible. This is what makes omeprazole so incredibly effective. It doesn't just put the pumps on pause, it shuts them down for good. The only way your body can start making acid again is by building brand new pumps from scratch. And that whole process takes about 24 to 48 hours. That's why just one pill can give you relief that lasts for so long. So, with a mechanism that powerful, it's really no surprise that doctors prescribe omeprazole for a whole range of medical problems. Yeah, its use is incredibly wide. Of course, you've got GERD, which is that chronic, nasty acid reflux, but it's also a key player in healing painful ulcers in the stomach and intestines. It works with antibiotics to get rid of that pesky H. pylori bacteria. It's even used for super rare conditions like Zollinger-Ellison syndrome, where the stomach just goes wild producing acid. And it's crucial for protecting people who take a lot of NSAIDs or are critically ill in the ICU. But hey, with great power comes great responsibility, right? A drug this effective has some really important safety information, the fine print that everyone taking it should definitely be aware of. Okay, let's break this down. On the left, you've got your more common short-term side effects, things like headaches or an upset stomach, which are usually pretty mild. But on the right, and this is what doctors pay close attention to, are the potential risks that can come with using it for a long, long time. See, constantly lowering your stomach acid can make it harder to absorb important nutrients, like vitamin B12 and magnesium. And studies have linked it to a higher risk of things like bone fractures and certain infections. It's a big reason why you should always be on the same page with your doctor. This warning sign is here for a reason. We've got to hit the brakes for a second, because there are absolutely some situations where omeprazole might not be the right move. So who should definitely stay away? Well, first off, anyone who knows they're allergic to PPIs. It's also a big no-no for people taking a specific antiretroviral drug called rilpivirine, because that drug actually needs stomach acid to work properly. And doctors are extra careful with patients who have liver problems, with the elderly, and this is critical. They want to be sure that the relief from omeprazole isn't just hiding or masking the symptoms of something much more serious. Your body isn't a one-way street. Omeprazole gets processed in the liver, which is like this super busy traffic intersection for all kinds of medications. That means it can totally interfere with how other drugs are handled,
like the blood thinner clopidogrel and a few others. It's the perfect example of why it is so important that your doctor knows every single thing you're taking.
So, after exploring its incredible power and its potential downsides, we land right at the heart of all modern medicine, the balancing act. This image just says it all, doesn't it? With any drug, but especially one as potent as omeprazole, the entire goal is to make sure that the benefits, the relief, the healing are always weighing more heavily than any potential risks. Okay, so let's wrap this up. What are the big things to remember? 1. Omeprazole is a super effective PPI. 2. It works by permanently shutting down the acid pumps in your stomach. 3. It's a fantastic tool for a ton of acid-related problems. 4. Using it long-term means you and your doctor need to keep an eye out for risks. And finally, the golden rule of medicine. Always use the lowest dose that gets the job done for the shortest amount of time you need it. And that leaves us with one last question to really think about. In a world where you can get this medicine so easily, are we using this powerful tool the way it was designed to be used, as a short-term solution for a real problem, or has it maybe become a long-term crutch for some of us? It's a really important conversation to have, both with yourself and, of course, with your doctor.